Hi everyone, welcome to our special Famhealth Live. जैसे आप सबको पता है कि इन दिनों हमारी यही कोशिश रहती है कि हम टॉप नॉच डॉक्टर्स को आप तक लेकर आएं, क्योंकि आपका डॉक्टर्स तक पहुंचना बड़ा मुश्किल है। एंड इसी के चलते आज हमारे साथ जो स्पेशल गेस्ट है, हमारे एक्सपर्ट जो है, उनका नाम है डॉक्टर इंदु खोसला. She is a practicing pediatrician. She is a pulmonologist as well. She's a pediatric pulmonologist with over 30 years of experience. And ma'am is a consultant at Leelawati Hospital. In addition, she is also a director at Dr. Indu's Newborn and Child Care Center in Mumbai. Ma'am, in the middle of all this crisis, you took out the time to talk to us. Thank you so much and welcome to Famhealth.
Thank you so much for inviting me. Yeah.
Ji, ma'am, would you like to give us a little brief intro about yourself?
My passion has been children, and therefore I'm a pediatrician, and I've been working with children for more than 30 years. I have my own hospital, which is a 25-bedded hospital for children at Andheri. But my main interest is asthma in children and other lung diseases. I also am a speaker at various forums, and I train pediatricians in the country for lung diseases in children. Also, I work at the Leelawati Hospital, which you have just mentioned. Yeah.
Yes, ma'am. So you have your hands full, and all the more pleasure for us to have you with us. Ma'am, could you please shed some light on the current COVID crisis? And when it comes to children, although there are many studies that are suggesting that children are, relatively better off when it comes to COVID. Not to say that, they are immune to it, but then their body, is able to fight it slightly better. Ma'am, what are the latest stats on it? And please shed some light on that.
Yes, you're right in what you're saying, that children are less affected with COVID. There are multiple reasons for it. One of the reasons that we are seeing is because children have less comorbidities. When we say comorbidities, their lungs are still, I would say, younger, less damaged. Okay, so these are kids who can therefore fight the virus better. They also are made a little differently. So there are various theories in the medical field why children are less affected with COVID-19 compared to the adults. One of them is their kind of immunity that they have. The fact that they already have other viruses. Children keep getting colds and coughs, so they have other viruses, and therefore that is not permitting the COVID virus to come in. So these are all speculations, but it is a fact that children are less affected than adults, and thankfully so, they are less affected.
Yeah, ma'am, when it comes to this COVID, literally no one was ready for it. So we are learning on the go. We are learning as new guidelines are coming in, as more and more data is getting, research around the world. And when it comes to children, ma'am, in addition to the general tips and the general hygiene measures which are listed out there, what are some important hygiene measures that you think are crucial for parents to make sure that their children follow?
So just to give you a brief, the COVID virus is a coronavirus, and this is not the first time that the humankind had an onslaught with the virus, the coronavirus. So this is called the SARS-2 epidemic, and this is the third time that a coronavirus is affecting humankind. This virus has mutated. It is different from what it was earlier, and normally it's found in bats, and from bats it has gone into a middle host. Probably they say it could be snakes. And from there it has come to the human beings. Okay, this virus is transmitted through the aerosol route. When I say the aerosol route, it is transmitted through our secretions which come out through our nose and through our mouth. So if I were to cough loudly, I will generate some aerosols. If I were to sneeze, I would generate even more aerosols. Okay, so this is the main route of transmission. So therefore, we need to prevent the transmission by prevention of generation of aerosols. So somebody might cough suddenly, or you may have a sneeze which is suddenly. So how do you prevent it? So you advise people to wear a mask. So we are asking them to wear a mask if they are coughing and sneezing, so that the aerosol is not generated. Once the aerosol is generated and you have the virus in your secretions, it stays in the air for more than up to 6 feet. It can stay there, and there are studies to say that it can be suspended in the air for a longer time. So children, so you need to have a proper cough etiquette or a hand hygiene. Both, you need to have both. So if you have to cough or you have to sneeze, you have to go into your elbow and sneeze so that you don't infect others. you need to, and you don't need to touch your face, your nose, your mouth very often, because if you're coughing and sneezing and you're going to be touching your face very often, you're going to carry the bugs, and then you're going to touch something else, and you're going to put the bugs there. And children have this habit of touching the nose, putting everything in the mouth all the time. So what do parents do? Even if you tell them don't do it, they will still do it. So what do? You ask them to keep washing their hands. All right. So the more they wash their hands, though even if they have touched something, then you wash with simple soap and water. You can use any sanitizer which has about 70% alcohol. That is the correct sanitizer to use. But washing hands is equally effective. So wash hands more frequently. So hand hygiene, cough etiquette is what I would say parents should inculcate in children.
Very well said, ma'am. Ma'am, when it comes to masks, now it is kind of, in a way, in so many states across the country, it is like mandatory when we are stepping out of the homes. Everyone has to wear masks. And the same thing, I believe, applies to children as well.
Yeah. So masks are of two kinds. The one which is worn by healthcare professionals. So you have the N95 mask that everybody must have heard of and everybody must be trying to procure. So there are enough duplicates in the market, which I would definitely say it is not for the common man. N95 masks are for doctors, for healthcare professionals who are dealing with COVID positive patients so that they stay protected and the virus doesn't come into them. For the common person, you are wearing a mask. One is if you are having cold and cough, your germs don't go out. That's the first reason why you're wearing a mask. The second reason you're wearing a mask is somebody sneezes in front of you. So that germs really we try and say that hopefully that should not come. But the first reason is more important. If you're having a cold and cough, you're not spreading the germs. It's extremely important that the mask should be clean. It's extremely important that if you're using a cloth mask, it should be washed daily. And we should not keep fidgeting with it because then you're actually touching it and getting the germs in your hand. It's important that it covers your nose and your mouth. So everyone has to wear a mask. If you're stepping out of the house, you need to wear a mask. And there are countries in the world like Japan and some other countries where they have regularly used masks and there the infection rate has been much, much lower. So there are studies to show even a simple cloth mask would work for the common man and leave the N95 for the healthcare professionals.
Yeah, ma'am, very well said. Ma'am, since you are an expert, and in addition to being a pediatrician, you are a pediatric pulmonologist. So, ma'am, you already are handling children who have lung problems and who have allergies and asthma. Is this group of population or are these kids more prone to COVID? And how do we differentiate as a layman or as a mother? How do I differentiate if my child, the cough that he or she is having, it's a regular cough or is it COVID?
A very, very nice question. So children keep getting colds and coughs. And I think today, because of our environment, the pollution, the fact that children go to play schools at a very young age, right? So they get infected from each other, right? And the overcrowding that we see in every place of life. So we get a lot of viral infections in children. So it is the commonest reason why a parent would visit a pediatrician today. The commonest reason is a cold and cough and a respiratory infection. So when we talk about the COVID virus, it is not like a normal cold and cough. Though in children, the infection is milder, but in an adult or in a person who's really affected by COVID, it comes with very high fevers, chest pain, breathlessness, which is progressive. So if you have a runny nose and mild cough, it is not likely to be COVID, right? So if you have something coming into your chest and you become breathless and you have high fever and a body ache and a headache, that's likely to be COVID. Now, if you have a child who has asthma and who is on inhalers or on preventive therapy, my first take-home message for all parents whose children have asthma is please do continue your inhalers which have been prescribed by the doctor. Do not stop them, because it will create a lot of confusion in your mind whether your child has got an asthmatic attack or whether he's got infected with COVID. Okay, so it is going to cause you a lot of anxiety and which is going to be unnecessary. And it is better that we keep these children more protected than the other kids so that they continue their inhalers as prescribed by their doctors. Generally, as I told you, asthma doesn't come with fever, but COVID infection will come with fever. So that is one very important differentiating factor. But if your child is coughing very badly or is breathless, you definitely need to take him to your doctor for further advice, for an examination, or for investigations if required. So stay indoors. That will reduce your infection. We are fortunate that we don't have too much pollution, so infections are anyway down. We are following hand hygiene. So that has brought down other viral infections, the flu virus infection as it is. Continue your inhalers so that you will reduce your asthma attacks. Okay, so if you do all these four, you're not going to get unnecessarily worried. Now, there may be children who have severe lung disease. The number would be small. They are like having a comorbidity or a risk factor for getting. I would say, again, follow the basic steps that maintaining hand hygiene and staying indoors. And I guess you would be all right.
Yeah, ma'am. I think you have put it up really well, and thank you so much for clarifying this thing, the difference between asthma and the difference between a viral infection per se, COVID-19 infection. Ma'am, since I'm a mother of an 8-year-old, and we've been trying to work from home and trying to balance things out, one of the things that I am juggling with is the impact that this lockdown is having on the physical and the mental well-being of children. And if it's bogging us down, I can't even imagine what it must be doing to our children. So, ma'am, what are some important things that we as parents should keep in mind, since our children are also locked down and they are also processing so much of stress in their own ways?
So I had a 7-year-old. We have started doing teleconsults and video consults with parents now, because we don't want them to come out. So this is also one advice that I would give parents, that if you have a doubt, please speak to your doctor and consult through a phone or a video consult. So I had a video consult recently, and this was a 7-year-old girl who had symptoms of, the child was vomiting a lot and was not wanting to eat food, and the mother was really worried. The parents were both bankers, and they're working from home like you. And they were even busier. Bankers are now become even busy because they know people are going to default payments. So they're working at the back end much, much more than probably working at office. The pressures are immense. So this mom had to go to the bank on Monday because of the work that she had. And she came back, and the child and the anxiety of the child began from there. So she was worried because the mom has gone to work, whether she would get infected, whether she would get COVID. So our anxiety always rubs on kids. If we are relaxed and cool, children are cool. But if the child sees that we are stressed, even if we think that the child can't see it, the child can sense it. And the child knows they are stressed, so the children are stressed. So how do you prevent it and how do you handle it? Okay, so this child had just stress because mom had gone out one day and that was bothering her. And that was really bothering her. And she was wondering if it would affect the mother and something would happen to the mother, and that was bothering the child. So my first suggestion is, please talk to your children. You may be working from home. Take out time to tell them the facts. Tell them what is COVID, who will get it, that they are not at risk, and we are following the hygiene, or we are following the preventive steps. We are not at risk. Tell them facts. Don't hide things, but tell them in a way that they can understand, in a simple way, without scaring them. But they should not get the impression that you're hiding things from them. They're going to get more anxious there. Okay, they have lots of ways of understanding, of getting information today. So please be honest with them and talk to them. Then structure their day into physical activity, into mental activity, so that they're busy. An empty mind is a devil's workshop, right? So you must structure their day and physical, since we are all homebound now. So you must plan good physical activity and good mental activity. Fortunately, many schools are sending online work, which is great so that children are occupied for some point of time. But still structure their day in such a way. Children like structured programs. Therefore schools, therefore habits, therefore discipline. So please follow that. And that will keep your children well and healthy.
Yeah, ma'am, very well put. In fact, where my daughter, the school that she goes to, they also recently started classes, and I did notice a remarkable change in the way she was, feeling throughout the day. It does have an impact, like you rightfully said. Routine plays a very important role in ensuring that the mental well-being of children is, on the right track. Ma'am, when it comes to diet, or when it comes to immunity, or to boost their immunity, does diet play a role? And what kind of food or what kind of diet do you, do you think we should, as parents, make a part of their daily routine?
So if you go to the WhatsApp University, you have hundreds of messages and hundreds of advices, right from vitamin C to zinc to vitamin D to God knows what not, like how you had papaya leaves for dengue fever. It just goes on, right? So I don't think you should believe the source. The source where you get information is very, very important. What is important is we should eat healthy, nutritious food. We're sitting at home, we're going to be eating more. So we need to control that. We need to eat less junk. But there is no specific diet which will prevent COVID or will give you immunity against COVID. Okay, what you need to eat is you need to eat healthy food. It should be nutritious. It should be balanced with your carbohydrates, proteins, fats, vitamins, minerals, all should be there. And that's how it should be. So all these gimmicks about vitamin C, it's not proven. I'm not saying that it may not help. Maybe in the future there will be some study which might show that this helps. But as of now, we have no data to say by having this or not having this, you're going to prevent COVID. But eat a healthy, nutritious diet. Please exercise, very important.
Yeah, ma'am, and are there any activities for their mental stimulation or something that you think that isn't it important that as a family we should engage in activities where parents are also a part of any form of activity that will keep children mentally stimulated?
Yes, of course. See, fortunately, we have a lot of avenues today. I think you must, parents and children, everybody should, but in life always goes up and down, correct? So whenever it is down, there are some ups in those downs also. So I think it's a great time to have a good family time. So spend good time, watch good movies together. Don't spend too much time on screens, but normally as pediatricians, we say no screen time. But this time I would say, okay, use some screen time judiciously, all right? So see good movies, play board games with them. You could play any mental games with them, and our good old carom board and chess and snakes and ladders, depending on the age of the child, you can really modify. You can put on some physical activity on your YouTube or Netflix or whatever, and the family can exercise together. It's such a fun time. The family can dance together. You can enjoy some music together. So there's no end to it. So I think you should utilize your time, and of course you can read books with them, read story books and read books which will impart good information. So these are all the ways that you could keep your children busy and mentally engaged as well.
Ma'am, that's a very good piece of advice, and I'm sure all the mothers who are out there who were waiting for this advice, they are going to be benefited, and so will the children. Ma'am, just a while back you did discuss about how to differentiate between a common asthma or a common allergic reaction with COVID. Ma'am, but then secondly, how do we differentiate a common cold and flu from COVID?
So a common cold and flu are milder illnesses. So you'll have some runny nose, you may have a little cough, you may have a mild fever, which will last 2, 3 days, 4 days. And by the time it is the 3rd and 4th day, it always shows sign of recovery. COVID starts worsening on day 5. The fever gets higher, your chest pain will get worse, you might start getting breathless, things like that. So, and it is a systemic illness. And most important, there should be some history of some contact. We have community spread, but it is not still that much of a concern. If you're indoors, you don't have anyone who has traveled or who's not sick with COVID, you're less likely to be getting it. So I think you should not worry unnecessarily. But if you have a doubt, you must definitely speak to your doctor, who is your best judge for you.
Yeah. And ma'am, are there any, like you just said that breathlessness. So are there a few important signs and symptoms where you recommend parents to immediately go and contact your doctor?
I feel if any child has fever beyond 2 to 3 days and you don't know the reason for the fever, okay, or your child is uncomfortable, sick, not eating, or is breathing fast, you need to go to the doctor. In these times, one would not like to take a chance. So any fever which is going on beyond 3 days, which you don't know the reason, please consult your doctor.
Yeah, ma'am, that's actually a very important message. And ma'am, could you also shed some light on the vaccination? Because a lot of parents are writing to us on, like I had mentioned to you, that we run a community. It's famhealth.in/community, where we have various groups, and one of the groups is is pregnancy and childcare. And a lot of mothers are reaching out to us and asking us what should they do about their immunization schedule, and should they go ahead, should they delay it? So ma'am, is there any protocol for that?
Yes. So the ICMR has just yesterday released a final advice bulletin even our Indian Academy of Pediatrics has released an advice bulletin on vaccination. The primary vaccines have to be taken. So when I say the primary vaccines, I'm talking the vaccines of the first year. They all have to be taken. They can be delayed by a week or so, but generally they should not be delayed beyond that. What you need to do is you need to schedule an appointment with your doctors. Many doctor clinics are still working. You schedule an appointment in such a way that when you go to the clinic, you are the only patient and there are no sick patients around. So if you speak to your doctor, I'm very sure your doctor will schedule an appointment slot in such a way that you can go and take your vaccines. So do not delay the primary vaccines. The vaccines which come after the first year are the boosters, or they can be delayed. So they are, even if they're delayed by a month or two, there is no harm. Please take your seasonal flu vaccine, because come May and June, we start getting flu. So that we don't want it to complicate COVID. So please take your flu vaccine and all your first year vaccines. When I talk about first year vaccines, the polio, the triple, the hepatitis B, the Hib vaccine, the pneumonia vaccine, that is the pneumococcal vaccine. I'm talking about the measles, the MMR vaccine, the chickenpox vaccine. All these vaccines have to be taken, because if we delay these vaccines, post the COVID era, we will have an outbreak of vaccine preventable diseases, which we don't want. So schedule it in such a way that you go to a clinic when there are no sick kids.
Yeah, ma'am. So like you said, the vaccines which are in the first year, they need to be given, and it's best to like consult the doctor and arrange an appointment. When it comes to appointments, ma'am, these days one has to be really careful about stepping out and going and seeing a doctor. Are there some important tips that you would, or etiquettes that you would like the parents to follow if they want to get their sick child checked up by a doctor?
Yeah. I think this is important not only for the patient, the child, but also for the healthcare providers. And here we have to work together that we are both safe to each other, right? So first of all, take an appointment. Call up. Please identify the reason why you want to come. Whether you want to come for a vaccine or your child is sick. If your child is sick, please give the basic history to the person who takes the call. What is the complaint? So if it's something like a simple diarrhea, or the child has some skin rash, or the child has fallen down, we are all on safe grounds. But the child is breathless, child is coughing, child is having high fever. So you need to inform the doctor well in advance. At clinics now, we take the patient, all patients should be masked. Below age 2 years, we do not recommend masks because it can be dangerous. But above that, everyone, the relatives of the patient have to be masked. We take one relative with the patient. We don't need to have, because you are going to increase the exposure to the risk of COVID. So we take only one relative. So one relative should come with the child. Okay. And as I told you, they should be masked. And they should take a proper appointment and come. It is important there are certain guidelines as doctors we need to follow today to examine a patient. So which we are going to follow, which I think everybody has to cooperate. So like say for instance, throat examination is not allowed. Nebulization in the clinics is not allowed because it's going to generate aerosols. So a lot of changes have come in, which all doctors are aware of it, and they are going to follow to safeguard themselves. So I think these are important things that you need to follow when you go to a clinic. Don't overcrowd, don't unnecessarily waste time in the clinic, your own time, because the longer the duration of exposure, the higher the risk. If it's crossing more than 15 minutes, then the risk is higher. So follow that discipline. And I think it's high time we all get disciplined when it comes to handling patients and healthcare.
Yes, like ma'am, you said that we have to, this is the new norm. So we have to get used to it. We have to make changes, and every individual has to step in and try and do their best. And that's how we are going to fight COVID-19 pandemic. Ma'am, I think we have covered most of the topics that were some important pressing issues by parents, but if there are some important tips or some advice that you would like to give parents out there, what would it be?
The first and the foremost thing is don't panic. Okay, stay calm. We have had pandemics in the past. We have had pandemics in the past with much larger number of deaths. Okay, that time there was no medical science to find out. Here, the moment the virus was identified, everything about the virus we found out. They found out some drugs which will work against it. They found out how the virus spreads. They're looking at a vaccine to prevent it, etc. So the pace of diagnosis, the pace of investigations, the pace of coming to spreading information is much better than what it was. And the number of deaths which occurred in the previous pandemics were mind-blowing. 5% of the population got wiped out. All right. And now we have medical facilities. Even the government of India is really working very well. And we know in Mumbai, the Nair hospital has now been a dedicated COVID hospital. 500 ICU beds have been, and doctors are really working hard. So I feel first is don't panic. The second is don't spread rumors. Don't forward WhatsApp messages which are not authenticated. It unnecessarily creates panic. All right. Thirdly, follow what the government guidelines are. The government is working, right? So just follow the guidelines. They stay indoors. Please stay indoors. Okay. No heavens will fall if you don't go out for a month or 2 months. What is going to happen? Nothing is going to happen. So this is the third thing that I would like to say. And the fourth thing is children are safe. So don't worry, but engage with them. Engage with them so that they are happier. This is what I would like to say.
Yeah. Thank you so much, Dr. Indu. I think you, in this brief duration that we had this interaction, you covered the most important things or concerns that come to every parent's mind. And if anyone who's watching this video, if you have any doubts or concerns or questions related to health, please log into famhealth.in/community. It's a free website. You can get great information from experts. You can get healthy recipes, fitness videos, and it's entirely free. It's extremely engaging. So please be a part of it. And ma'am, you took out the time to talk to us from your precious time. Thank you so much, ma'am. It's been such a pleasure.
Thank you.
Thank you, ma'am.
Thank you so much. Yes.